And so the first thing is like people generally when they think about like medicine as a whole, they tend to be a little bit skeptical about chiro as both like a service and as like a career. What are your thoughts on that?
Well, I think the whole skeptical side probably comes from like a lot of things from the past, whereby medical doctors, or as known traditionally as allopathic care, they focused a lot on symptoms and disease as opposed to prevention. So when that became their paradigm or their model, a lot of drugs and surgical care, which was focused on diseases and issues like that, was what they primarily took care of. So when you had a whole group of professionals also in the sphere of things more of natural based, like chiropractors, naturopaths, homeopaths, etc., we look at what's causing these and how can we prevent it.
Morning.
Oh, sorry. Sorry, man. We're shooting a podcast.
Sorry to hear that.
No worries, no worries.
That's okay. Okay.
We're
thank
literally
you,
in the
thank
first
you.
like 10 seconds of
Yeah,
it.
thank you. Thank you.
All right, take care, guys.
No
Sorry.
problem. All right, man. I appreciate it.
Am I in
man.
the
Thank you.
podcast? Or no?
Hey, there you go. Maybe. Let's see.
Maybe.
All right. Take care. Thanks.
That's funny.
Okay. Shit. I thought I was on a roll there. I don't know.
No worries.
Okay.
We still have good, but now we have
Okay.
also blooper.
Yeah.
Don't worry. It's funny because every podcast that I've ever seen, and like have like in general, like both online and in person, like that I've watched, there's always some kind of blooper where someone like walks onto the set
Yeah.
and doesn't know that what's happening.
So-
It's even funnier when it's like multiple, like they see multiple cameras and there's like microphones and everything, and then they still walk on to like deliver a package. But like it's funnier because they'll go up to the table, like into the shot, like right in front of the camera, and just deliver the package. So those are always funny. So
we want to do it again? We'll just take it from the.
yeah, I mean, if you want to just continue off.
Yeah, I just my train of thought. Okay, well, so with medical based care, a lot of the times they're looking at the diseases and how to address those and the symptoms. So a lot of the time that's going to be through drugs, medicine, drugs, or surgical procedures primarily. So when you have a whole other group of health professionals that are coming from a different sphere, looking at like what's the cause of this and not just the symptoms. Obviously, you have to address symptoms to help get things going, but you're looking at the cause and how can we prevent this. So you have a whole slew of preventative care. So because of that, the paradigms are different. So especially more in the past, the allopathic, the medical field didn't always want to accept this group, and vice versa sometimes. I think now with the way information is and everything like that, I think the gap is being bridged. I have a lot of friends that are in different medical fields, and we get along, we talk a lot about different things, and they'll ask me questions about stuff and I'll go back with them. I have one of my best friends is a plastic surgeon, and there's a lot of stuff we talk about because he does a lot of peripheral nerve stuff. So sometimes if I'm seeing some stuff and I'm thinking it's coming from the neck, nerve based, and I'll talk to him and he'll say maybe it's this peripheral nerve issue, and it's nice to do that. So now it's changing a lot. But to address your question, yeah, in the past, I think there was just like basically a gap between the two models of care, and now I think it's being bridged a little bit better.
Okay. So what are your thoughts when you probably remember like back in the day when there would be like some kind of people online who'd say like that chiros aren't real doctors and stuff like that, or they would think it's more of like a performative practice than like medical. Do you think that's changed?
Possibly, but I've never really concerned myself with that. Like I've always kind of looked at, I want to be a chiropractor to help people on this level of what I do.
Yeah.
And whether someone perceives it as A, B, and C, I don't really care. I don't, sure, you're going to be people will address me as, Dr. Dave or Dr. Sarathy based on my credentials. But I'm always introduced myself as a chiropractor because that's what I am first and foremost, and that's what I'm proud of being, and that's what I do. So Yeah, all that other stuff, it doesn't really bother me at all. I know what I'm good at, I know what I like to do, and I know that I'm here to help people within the realm of what I want to do. So that's really all I concern myself with.
Yeah. And so why did you end up choosing chiro out of every profession? Like, why not massage? Why not physical therapy? Like, why chiro specifically?
Well, when I was just going through health sciences at undergrad, I like more of the natural style of things, probably due to a lot of my personal philosophy. I don't need to really get into it all, but just the way I look at things and the way I live my life. So I kind of like that attracted me. And then from a professional perspective, if you take all the different types of natural health cares, I gravitated towards chiropractic because my mom, she received a lot of chiropractic care when she was dealing with a lot of problems, and she's seen a lot of benefits to it. And I seen her get better. I also seen her wean off some of painkillers and meds and stuff that they would try to prescribe to her. And her chiropractor had a really good approach with getting her off that stuff and helping her be more, self-sufficient with things. And I really liked that aspect of healthcare, so I gravitated towards chiropractic.
Yeah. Speaking on the kind of like natural path for healing, what are your opinions, I would say, on like plant medicine or like in the kind of brown community as like Ayurveda? Like, what are your thoughts on that versus what traditional kind of like hands-on healing, like chiro, massage?
So I think they work hand in hand. So I'm always extremely encouraging to my patients to see whether it's a naturopath, a homeopath, Ayurvedic doctor. Even I work closely with some acupuncturists and stuff like that. If they're treating somebody, we can co-treat. It's no problem. I don't have an issue with that at all. I think it's encouraging. I do, though, from any perspective, I do tell patients, like, don't try too many things at once, because then you want to know what's really helping. So if you do like one or two things and there's intercommunication between the healthcare professionals, I think that's the best way to go, because it helps the patient get an understanding, it helps the doctors and the healthcare workers get an understanding, and allows all of us to get the best results with the patient.
Well, what are your thoughts on some of the products that like you might find at like an Indian grocery store, where it's like maybe like a box of pills, and then like they're claiming on the box that it could help with like a variety of like bodily issues?
True. So I'm not too familiar with all the Food and Drug Administration, like what's allowed to be put on things, and also how much regulation is put on some of those products, especially the ones that are brought from abroad. I really don't know. However, there are like stuff like turmeric and ginger and different types of herbs. There's a lot of natural things that have helped people over the years, and there's a lot of things that have shown to help in different ways, whether it's reducing your blood pressure or whatnot. So with all of those things that have some backing to them, I'm encouraging towards that. But if it's like a package which just says this specific thing may help A, B, and C, I don't really know. I would be maybe slightly skeptical until I did some research.
Fair. I don't know if you've spent much time in like the short form content space, like TikTok, YouTube Shorts, Instagram Reels, but like there is like a plethora of influencers and like products coming out for the sole purpose of like back crackers. Whether those are like devices, like I'm sure you've seen. There's one product that comes to mind, which is like this kind of like half circle like foam board or what, like plastic board, where you would lie down and would basically crack your back. And I just wanted to know, is there any kind of legitimacy to cracking your back, or is it like just a purely satisfaction ASMR kind of thing?
Okay, so there's a lot of context and into the question you asked. So I'll break it down like this. There are those products. A lot of them, though, are less about releasing joints. The crack that sound is technically a cavitation. It's just being gas being released from the joints. But it has it has a lot of effects in different ways, which I'll get into. But some of those products are just more to stretch you out and keep you healthy and functional, which is good. If you do end up getting a cavitation or a release, that's just something that probably comes along with it. From my perspective, what I'm doing is when you're on the table, I'm checking your joints. I'm seeing how they move with relation to one another. So it's not about just moving any segments, because I can move a lot of your segments in your spine. It's not really a problem. It's what I've trained to do. I've been doing it for over 20 years, so it's not an issue. The thing is am I moving the right ones? What if things are moving too much? They're hypermobile. We don't want to move those. So you might come up to me and say, oh, when I do this and that, I get all these releases. Okay, that's great, but those areas are probably hypermobile. Maybe we want to stabilize those areas. But the ones below it and above it probably aren't moving as much because they're compensating and they're not moving as much and they're a little stiffer. So maybe those are the ones we need to just properly get moving, and the stuff that's moving too much, we need to stabilize. That's something that some type of board or device you have at home isn't going to tell you and isn't probably going to help you with. So there's that whole side of it, which you have to understand, where the professional aspect comes in, where the experience comes in, whereby that's how we're helping people to get better.
Nice. I always heard when I was growing up, I always heard that cracking your knuckles, like cracking your back, cracking whatever you can physically manage, that there's always the chance that it might cause arthritis. Is that like a myth, or?
I think if you do anything way too much, it's probably detrimental to you, whether it's grinding your teeth or whatever. But really, there's not a ton of evidence that shows towards that, because you're just releasing gas within the joint. But that said, probably doing anything too much isn't beneficial for you anyway. So it's pretty straightforward like that. Like, if you're doing anything way too much, you're probably going to end up having some type of degenerative issue or change going on.
What would you categorize as like too much?
Oh, well, if you're trying to release an area several times a day, that's probably too much. But if you're coming in for care because an area's not, because it's identified from your chiropractor that the area is not moving well enough and it needs to get moving, and we get that moving, even a couple times a week until it settles down and can maintain on its own and function properly, and we don't need to kind of get in there as often, that's perfectly fine. But it's when you just do something, some people will do the same release or movement several times a day, and that's probably not the greatest thing.
There's another thing, which is like, whenever you go on any kind of chiropractic website and you're like searching up like rates or whatnot, because that's what most people do before they even book a session. They look
What's that? Oh, rates.
Yeah, rates, like hourly rate or per session rate. But one thing that on every single website I have seen without fail is one of the symptoms being headaches. How does a potential person know whether their headache is just like a part of like the daily strain? Maybe you looked at your screen for too long, or like you're under a lot of stress, versus a headache that's the cause of something underlying.
Okay, so there's various types of headaches. You have migraines, you have tension headaches, you have cervicogenic headaches. So there's different types of headaches that are out there. A lot of the time, like a cervicogenic headache deals with our friends over here, deals with the cervical spine, the joints within it, decrease in motion, irritating some of the nerves, creating that headache. A tension headache is primarily due to muscular pain, which is usually the upper trap, which comes through here, or the suboccipital muscles on the bottom, which is something we look at, right? And migraines, even though they're kind of blood flow related, they also irritate the muscles around. So by getting relief through an adjustment, through release of the muscles and working on the whole area, because we also do a lot of muscle release, ART, and then also adjusting the neck in different ways, whether it's low force or regular adjustment, it really can help to alleviate headaches. I see a ton of headache patients all the time in the office, and it really helps. So yeah, that's a real thing there. Like, definitely, it's probably on every chiropractor's website, because it's something we deal with and help.
For those at home, when do you think someone should think about coming to a chiro, with a headache being one of them? How can they differentiate their headaches between just kind of like the normal daily strain kind of stuff versus like, hey, maybe this is something I should take a look at?
I don't think the everyday person always can. Sometimes a headache's a headache, and it can be miserable, right? It stops you from, if you're a student, it affects your studying. If you're an employee, it affects your, efficacy at work, being at the computer, doing things, just your general life and wellness. So if you are having any type of headache, it's good to get it looked at and get it identified, because we can help to kind of get you to the point where we see where the cause is and what's going on. And our job is tactile. We just don't sit there and say, where does it hurt? What's going on? Tell me. We get in there, we feel, we try to re-stimulate the area to get an understanding so we can help you. So it's always good to, if you do have those symptoms of a headache, to definitely come in and get that addressed. There's a lot of serious questions, Chintan.
Yeah, I spent my time like
Isn't it
last night,
hardcore?
like the last 2 days, I was like, I don't want to ask like basic questions
Yeah.
like, oh, what are your goals for your clinic? Or
Yeah.
like, I want to ask like actual, because I think about like questions I had, which is like, because I'm staring at a screen for like 8 hours a day, minimum. And then like no sunlight, because my basement doesn't have, like my basement has a small window. And so I try to think about questions that I want answered first off, which is, I don't know if that's considered selfish, but I figured that if I have questions, then someone else probably has the questions.
No, I like it. It's good. It's interesting. It's challenging me too to address things that I don't always have to address, right?
Yeah, because one thing for me is that like, I suck at explaining things, and so sometimes I assume the other person knows what I'm talking about, and so I try to ask questions that force me to talk about like the fundamentals as if like I'm talking to a toddler, and so that's the frame
Yeah.
I think about questions in.
Fair enough.
I want to ask a couple questions on, well, one question in particular, just about like kind of general health advice on the internet. And one is like, we see this uptick trend online, at least in the last few years, I've seen it personally, in things like cold plunges, red light therapy, naked sauning, like things like that. Do you see any merit to things like that, or is it just like something that's just a waste of people's time?
No, I don't think it's a waste of time. Like within my office, obviously, I don't have those facilities for like, some deep sauna stuff or cold plunging or anything like that. But I think with the cold plunging, I mean, there's a lot of benefit to that with like helping with anti-inflammation for athletes, flushing, right? Because all that cold comes in and then all the blood gets back into the organs to protect. And then once the cold is gone, then the blood flushes out. So it kind of helps to clear things up a little bit. So all of that, and that's been around for a long time in different capacities. So, I mean, I think different things have their merit. People need to do a little bit of research, talk to some people and see what works for them. But not being an expert on those things, just, I'd like to think, just from what I've read, that some of them do have their merit. It's just, you have to just look into it if you're going to jump into it. So.
Now, I want to ask you one particular question about your say personal life, but I want to ask, like, as someone in the kind of like natural healing space and I say operating, but like working with so many different kind of patients, what's one non-negotiable thing that you do every day without fail to kind of keep yourself in check, either physically or mentally?
So one thing I learned a long time ago when I started practice is like something like PTC, like present time consciousness. So I'm really aware of that. I'm aware that if you're coming to my office, right, you're getting up, you're, getting dressed, you're finding out where my address is, getting in your car and driving over. That's going to take some time maybe 5 minutes, maybe 20 minutes, it depends, whatever. Then you're coming into my office, it's a new experience for you, you're meeting new people, you got to fill out an intake form, so that's never always easy for people. So by the time you get in to see me, I need to be always with every single patient, whether it's a new patient or a returning patient. I have to be in present time consciousness. My mind, my energy has to be with you and connected with you because I'm here to help you. And you have taken the sacrifice and the time to come out all the way to see me, which I respect, and I value that you trust me with your health. So that's what I do, is I try to just be there for you. I'm gonna listen, we're gonna talk, and I'm gonna do the best I can to help you. And that's what I try to do with every patient every day. So it's something somebody taught me a long time ago, to how to approach things, and I try to engage in that way.
I definitely need to do that more often. I space out way too much during my day.
Everyone spaces out, but it just, your intentions should be like what your intentions are. Your intentions are always to do the right thing with your clients, and that's the main thing.
Yeah.
But like trying to be in the moment is good.
And that's a good philosophy to have, like, in general, not just like in work, but like
Very
with
true.
friends.
Yeah, in general, yeah.
Unless you have like friends that are like stoned every time you meet them, and then they're just like, I have that friend, but
You need some of those too sometimes.
yeah.
It keeps you grounded.
Both sides of the spectrum. In a career way, what's something that most people misunderstand about being a chiropractor?
I mean, I think there's a lot of context of the whole concept of like, oh, you're not like those doctors, like the medical and all that. Well, that whole idea, it's like, I don't know. I'm just talking about myself. I never wanted to be. Like, I want to be in this space. This is what I do. I'm a chiropractor, right? So, I mean, we're here to help. We use hands-on care primarily to help, alleviate not only your present pain, but get to the cause of it, the root cause of it. What's causing it? Why are these segments going out of place and creating these problems, and how can we prevent that from happening in the future? Like, so that's what I do.
Yeah. Just based off what you've kind of seen across your patients, what are some of the most common symptoms that you've seen come in?
I mean, I think with the whole age of like the phones and computers, there used to be this thing where a study was done where like 85% or more of people sometime in their life experience bad back pain. Okay, and that's something we always used to say, hey, come on in to see the chiropractor, et cetera, et cetera. And that was one of the things that we would touch on based on lifestyle. Now you're seeing a lot of upper back and neck pain, and shoulder, like upper back being shoulder blades, upper traps, all that area, and like rounded shoulders, and then the ribs hump out, and then causes problems in the mid back. And then when that happens, you get a lot of flexion in your neck, and it causes a lot of pressure through your spine. There's so many different things that all of these, the devices and the keyboards and all that stuff have caused, that now I'm finding those are things a bit more that need to be addressed. So there's a lot of postural structural exercises that we like to introduce along with the hands-on care to help alleviate the symptoms and then get back to the cause of it, realign the spine properly, and then the exercises help to stabilize and have everything function properly. So we've been seeing a lot more in the last 10 years probably of these neck and upper back problems with people.
What kind of, for those who sit at a computer all day, like myself, what would you say is like the most important thing you need to keep in mind to kind of maintain good posture like throughout your entire work session?
I think the first step is to, identify that you need to break often, and that's the first step. Forget about anything else you can do. Because what happens is let's say you're a math guy and you're solving some big equation, or a physics person, you can get engrossed in it and be there for, 20, 30 minutes doing it. You can be coding and be there for an hour without even thinking. You can just be doing your regular work, project managing, or whatever it is. It doesn't matter. You need to identify that maybe you need a break. And it doesn't have to be a long ass break, man. We don't need to take 15 minutes and wander around and but if you take like a few minutes, 3, 4, 5 minutes where you get up, you stretch out properly, you open everything up, you have a set of like neck stretches that you do where you're holding, I'm holding this side for 20, 30 seconds, that side, and you relax a little bit, do some breathing exercises, walk around a bit, and then get back. That's great. And I think if people can start with understanding that they need to take structured breaks and not overdoing it, and then getting back into it, and then within that break pattern, have some stretches, have some things that you can do. I think that works best.
Well, what about the people that'll say that that break will interrupt their kind of like their flow or their focus, and they're like the whole kind of productivity versus break kind of thing?
Well, it's short term versus long term. Sure, you may be affected in the short term of not completing that task 10 minutes earlier than you should have, or it's slightly affecting your flow. But I would like to think if you're a professional in the field you're in, you should be able to come up with a way to not have it affect your flow, like you jot down your ideas or you have some structure. And then while you just get up for those few minutes, you can still think about what you need to do. It's almost probably better to clear your mind and regroup, and then you get back into it. If you really feel that doing the right thing for your spine and your body and your mind in that moment is not worth it, and that you should sit there and grind it out, then you're probably going to be breaking yourself down in the future. So in 2, 3, 4 years, you may have a lot of other bigger problems that you're worrying about. But if you just take the time to do the right thing, it's just like exercise, right? No one's telling people to do a 2-hour crazy HIIT workout. But if they're saying like, hey man, if you can do 30 minutes to 40 minutes a day even 25 minutes and really focus on it and do it, it's going to help you in the long run, right? So it's the same idea.
So I'm just going to quickly check. Tea is interesting. I got approached by a band, like a music band, a few months ago, and they were trying to go from like wedding gigs to like corporate gigs. And I was like, guys, like I love music. I listen to your music. It's great. I have no idea how I'm gonna do this for you. I'm like, I straight up told them, I'm like, I'm gonna be honest. I have no idea how this is like, if I could do anything for you, because frankly, like I've never worked with any kind of like creator.
I got a guy that does a lot of corporate gigs as a DJ. Maybe you can pick his brain, because that's his thing. He has corporate space, which he gets into, and then he'll have those contacts and hire people to go in. So I can I'll see if I can. His name's DJ Respect. Respect, because he's a DJ. So.
Yeah, I mean, I'll try. Like they started ghosting my emails when I tried to get them on a call. Because I was like,
okay.
I'm like, I could do this maybe, but you're gonna have to like, and then they just ghosted.
Yeah.
And I was like, all right, whatever.
No, fair enough. No, maybe when you said like it's not something that's totally my space, maybe they pivoted a little bit.
Yeah, probably.
Possible.
Damn, we've almost blown through like all my questions. Mostly because I memorized a few of them.
Yeah,
but I didn't
you
realize.
can ask me stuff like other things.
Yeah.
Doesn't matter. Like.
And if you ever need like a break, like I can just turn that off.
Yeah,
well.
like I might have a coffee in like 20 minutes or something, but
Yeah.
10 minutes. Well, you can ask me about the kids' sports stuff because I'm coaching all the time.
Yeah. I guess
know.
yeah. Like, what's it like being a coach for kids? Pause.
Coaching the kids, yeah. Like, so there's so I'm like, so there's coaches that have like played like high level sports and done all of that, and they're like super serious with it and whatever, and they're like coaches. So I'm a bit of like a dad coach that's coach rep sports now, so I'm getting more and more familiar with it over the years. So it's a lot of fun, but a lot of the time, we get kind of roped into it because no one else is going to do it. And then you jump in and you do it, and it's fun, and you learn, and you try to get the kids going and everything. And there's ups and downs, and definitely more positives than negatives anyway. And any negatives you have to take as a learning experience for both yourself and the kids. And you go with it. But it is a lot of fun. And because of what I do, I can, from like injury prevention and all that stuff, I can bridge a lot because you identify something, like, okay, take a break, or let me take a look at it. And, so stuff like that's fun for me, professionally and also as a dad. So it's a good time.
And it's for baseball, right?
Baseball and hockey. But
Baseball and hockey?
hockey, yeah. Baseball, I'm a head coach of my son's team. In hockey, I'm an assistant coach, so I just help out. But for both of them, there's, and then you gravitate, right? Some kids connect really well with certain coaches and others connect well with other coaches. So you sometimes have to identify that and, okay, you know what? You manage this guy. He kind of likes you a bit. This guy's more your style, right? You can't put the hardcore OCD coach with the ADHD kid.
Yeah.
They're gonna go crazy, right? Both of them. So you have to so you have to kind of figure stuff like that out. All that stuff is important too.
If you had to kind of like go down the list from like sports and then their kind of associated most common kind of problem area in the body that like chiro could fix, like what would you say?
I mean, primarily you're talking spine, right? Like that's what we do. So if you're getting outside of the scope of like the pure hardcore sports guys who would like look, I deal with shoulder or knee or whatever. Like traditionally for chiropractors, we're looking at the spine, neck, mid back, low back, hips, any issues like that. And then secondarily, we're looking at knees, shoulders for sure. Like I've had a lot of shoulder problems growing up, so I like to deal with shoulders a lot. And then, forearms, wrists from a throwing perspective and everything, a lot of those throwing sports, like baseball, you're getting like, ulnar collateral ligament issues, forearm flexor issues where the nerves get impinged, shoulder issues from, sometimes throwing, secondary, primary shoulder impingement, all these different terms, sometimes neck and back stuff. And then, from other sports where there's a lot of legs and stuff like that, like basketball, sometimes you get some knee, calf, hamstring, all those things. So it varies. You get a little bit of everything. Yeah.
A little bit of everything.
Yeah.
What are some reasons you think people start developing pain in their bodies, and what should they do to prevent that?
So as adults, developing pain in the body, because kids, sometimes it comes with growth and changes, and there's different things, and then kids get better quicker. With adults, I think a lot of it is certain patterns that they're doing. I feel just from personal experience, from seeing so many people, that, if you have a sedentary lifestyle, it's not great for you. So once you get going and doing things, you can get hurt or irritate things because you're not active enough. So it is important, to be active and moving around. Like I like that saying, motion is life. So, you always want to keep your joints moving. It's like if you park your car for 3 months and then the engine might not start, or if the engine starts, the brakes may all be all seized up, or there might be another problem coming around, right? But if you're always, driving it a decent amount and taking care of it, it'll run properly. Same way with the body, but even to the nth degree, because our bodies are so complex. So motion is life. Keep moving, keep functional, and you'll definitely more likely than not see less problems.
Right. Almost like every one of your responses, like I've envisioned as like a potential like short form thing, because it's like, like those clips you see.
Mm-hmm.
I'm like, every answer is like clip worthy, because normally like you would record for like several hours and then you'd maybe find like maybe 4 or 5 clips, but every response has been like banger, 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 banger.
Oh, good. Well, at least this way maybe you can throw some little graphics in and then you get like a short or something, right?
Because like the whole idea for this podcast was like record like one just giant stretch.
Mm-hmm.
You can upload just the giant stretch unedited. Then any kind of stories can be YouTube videos. Mm-hmm. And then any of the kind of like bite-sized, like worthy, valuable info or like the short form content. And then those you can do YouTube Shorts,
Yeah,
Instagram.
that way I can get my Instagram going more.
Yeah. TikTok,
so,
all of that
yeah.
stuff. And then that way it's like, because realistically, for every business owners, and I've had my other clients actually like come and ask me like, hey, it's like, I want to start a podcast. And I'm like, that's funny. Everyone else has also asked me, how do I start a podcast? And I'm like, but it makes sense because for business owners, starting a podcast is probably the most time effective way to create a bunch of content while still like not taking a lot of time away from like their craft or their business. Because like realistically, it's once a week, you sit down, you record for like anywhere between 1 to 3 hours. You've maybe got like 2 or 3 YouTube videos from that, and you've got like a ton of shorts, and then you're good. And then you just do it.
It makes sense, like the live podcast, to do that.
Yeah.
Okay, so a lot of the videos you'll see like on Instagram or TikTok or whatever with chiropractors, they are definitely doing adjustments, but the loud sounds, like sometimes you'll have patients come in and you'll get a really nice release and then be like, it sounds louder on the videos I've watched. I'm like, yeah, well, those guys are using microphones or whatnot, right? But a lot of the time I will get questions about that because people recently are finding it fun almost to go online and they'll see chiropractors and they find that interesting. Like, oh, look, he's releasing these joints or that cracking sound or, and what's that like? And so we will have people just come in for that. I've seen it, I've always kind of had this pain, but I've seen this on like Instagram with these guys and this and that. So then, sometimes we'll adjust people. So it's good that that's all out there. I haven't really done too many of those because like I don't know if it feels a little gimmicky or whatever, but maybe I should do a few and just post them up. But I think, I just think in general, getting adjusted, having your spine realigned, having those segments that are restricted moving properly is just really, really important, and you will feel the difference. And then we also work on the muscles that that attach to the bones and the joints so that they're all released, and you will feel new again. You'll feel a lot more rejuvenated, a lot more flexible. And I also get the response, I feel a lot lighter. I feel a lot, less tense. And that's what we want to do. And you will really see that difference in your daily performance of life. You'll probably be sleeping better, be more effective at work if you're having less pain and less stiffness, and just be, and even doing the things you love to do. If you're a dad and or a mom or whatever, and you're playing with your kids and you're doing things and activities, if you just have a little bit less pain or a lot less pain, and the joints are moving better and you're more functional, you're going to enjoy that time better. And that's the difference, right? It's a quality of life, and everybody deserves that. So it's something we try our best to help people with.
What's about like the whole kind of like transformative journey? Like, what's one case you don't think you'll ever forget?
Well, there's like you always kind of get into a few different ones. I always remember there's this one patient, and like it's like legit. She was a younger girl, and every time I would adjust her neck, her vision would improve, and it would last for like 3 or 4 days. And there was another person I had in breathing issues, and every time we adjust the mid back, the thoracic spine, it was really clear, especially if they had some bad asthma and everything. So that always helps. So there's been a lot of different ones. Sometimes a person with the chronic back pain, it's just been miserable for them, and then you're able to stabilize that over time, like over a short period of time, and they start feeling better, and they're really thankful about it. And a lot of the time, like let's not think it's all on us, right? Your body does the healing. So the better you take care of your body, the better mindset you have. And also, of course, there's various things like genetics and different things like that, which play into a role. But I believe as chiropractors, and it's something we're taught philosophically in a sense that we're there to facilitate and to help. If I can help to remove that interference and give your body a chance to do the healing, then that's what we want to do, and that's great, because I'm not here to take credit for, when you ask that question. Yeah, sure, there's a lot of cases, but a lot of the time it's not just me, right? You're dealing with a person in a human body, and if that person is good and responsible, compliant with care, good at home, good with exercises, has a positive mind state, for sure all of that's going to help them get better quicker. So a lot of it is kudos to the patients too.
I have the like the really generic question, which is like, what's the goal you have? But that's like that's like something you would ask like.
I probably answer that too, like within my spiel of speaking on something, like, I don't know, you know what it is though? It's like genuinely, wanting to help people. I find like with any person with an issue, right? A lot of the time you're gonna have 20% of those people really confident in coming in and being able to socialize with healthcare workers and professionals. They're okay coming into the office. They've visited a chiropractor before, whatever. They're just those kind of people. Those personality people, easygoing, outgoing. But for the majority of people, they're not. If they have an issue, they're a little bit concerned with it. Maybe they're a little shy. Maybe they don't like to always have someone put their hands on them like a stranger, like, whatever. So we have to be delicate and take into consideration all of that when someone enters your office. So, my goal is to be considerate to all of that and make them feel warm and welcome. And I think the best way to do that is just by being yourself and just being, a regular everyday person, which they can, relate to, which I feel I am, like I hope I am. And then that kind of gets them comfortable, and then you have the dialogue of what's going on. And people always want to know, Chintan, they want to know, like, what's wrong with me, right? Because sometimes they don't exactly know. One guy's going to tell this, that. Dr. Google's going to tell them a million things. So they want a professional understanding and opinion on what's wrong with me. Give me a diagnosis. What's wrong with me? Okay, this is what's going on. And then the next question is, well, I'm here, so can you help? So yeah, you know what? Yes, if it's an issue we can help with, yes, this is something we can help you with. And then the next thing is, how long will this take? Because everyone wants a timeline. People have goals. They have they have their livelihood they want to get to. So they want to know how long will this take? So we have to give them a realistic timeline and understanding based on that. Once you plant those three things into your patient's mind and heart, and they understand where they stand with this, I think it takes a lot of pressure off them. I think it helps their mind state, and that's where the healing starts, is up here. And then it helps us to do our job and help them. So those are some of the things that I like to try to, address with patients when they come in. Yeah.
If you had to create a mental checklist that you think everyone should go through when they're operating any kind of device, whether they're like on their phone, whether they're typing on a computer, like what's the checklist that they should go through every so often to kind of make sure that they're not like.
That's a good question. I mean, that's maybe something I should look to implement somehow with patients, is like a little bit of like a 1, 2, 3 checklist, right? But I think mentally, one thing we always talk to patients about is, you're not always going to be walking around like this 24/7. Some people do, which is fantastic, And we all know them. There's the one kind of auntie or uncle that like just walks around like, with the great posture or whatever. But for the most part, people will have a tendency to slouch. So what I like to tell people is, get your shoulder blades back and relax your traps, relax this area down, and squeeze your shoulder blades back, and that just helps you automatically to be straight. So a lot of the time people are doing something and they'll forget to do that. And consciously, it's important to always have a good straight spine, because over time, the more you hunch, gravity is hitting the top of your head. So now, if gravity hits the top of your head and your spine is like an S-curve, it dissipates the forces. So it always allows your spine to stay healthy for the most part. There's going to be natural wear and tear with age, but this helps you to prolong, right? if you start hunching, then the gravity point changes and hits that back of your neck. That's those people that get those big bumps on the back of the neck where that C7 starts to stick out, and then they get back pain, and then they start to hunch, and then everything else starts to accumulate, right? And it even affects your organs. The more you close in, if you're open up like this, everything's nice and open, right? Your heart, your lungs, everything, your breathing. So everything plays a role. So as long as you consciously remember to get those shoulder blades back, squeeze them together a little bit, lower the traps, concentrate on your breathing. That's a big thing. So, and when you do this, you don't have the time. So you have to get that mental check where you're like, oh, okay, I've been doing a little bit too much of this. I'm going to put that phone away. I'm going to just stretch out a little bit. Back to what we talked about earlier about having that check where you need to take that break and take care of yourself. Because there's no way you're going to fix it. When you're on the computer, you're on the computer. Even if you're at a standing desk, you're still, right? You're standing, so you're not sitting, so you're taking pressure away from your low back. But when you're standing in on the thing, you're still affecting your neck and your upper back. So just always have those checks, man.
Yeah. Yeah, fix my posture.
Yeah. Whenever you talk about it, right? Everyone does. Even I'm going to do like this. This is comfortable. It's nice. But then you're going to see, like, I'm always, going to straighten out and try to, be like this. It's like, when you a good way to, I say to people is, if you go to an event, like a gala or something, or a wedding or whatever, and all the women are all dressed up nice and the guys are all dressed up nice, you got that confidence, you got that swag, you enter the place, you're not gonna be like this. Everyone's always like, when they come in, right? When they enter those banquet hall doors and they come in, they're always like looking good and grand and with nice posture. And that's how you should think about it all the time, right? It's important. There's a reason why this means confidence and positivity and energy. And this means meekness and insecurity and frailness. There's a reason, right? Over time. So we want to be like this. So the mental has to be a reflection of the physical too. So, it's important.
Having good posture just gives you a +1 on your attractiveness.
I think so. I think you know what, man. If there's if a girl if you're at on a date and I've been married for a while. I haven't been on a date since I met my wife. But if you're on a date and you're like this and talking to someone and that doesn't come off right. But if it's somebody that's boom, right?
Yeah,
it's different. So I'll tell you this story. I remember there's this guy. He's a big guy. He's with this attractive girl. So me and my wife were at this restaurant, bar they call the Black Bull. So it was during March break. So usually in March it's cold. This March break, I want to go back maybe even 10, 12 years ago. It was really nice and hot. So they actually were physically pulling out the patio that day. Really nice day. So we were in line and these guys were here, right? So we were in line, they were just ahead of us, and there were 3 or 4 more people ahead of them. So there were these guys at this table. And they were just finishing up their drinks, you could tell. So this guy he's with his girlfriend. And he's like, and then he just kind of big guy, and he just chest is like that, right? And he talks to these guys, and he says, "Hey guys, do you think if I pick up your drinks, can I just join you at your table?" And they're like, "Yeah, man." So he just goes over there, buys their drinks. So him and his wife now have a seat instead of waiting for 4 people. He goes and sits down, and he has this posture, and he's just walking like this. And I remember my wife just looking at him like, wow. She goes, "That's pretty hot." And I'm just like, hopefully you don't put that on the thing. But she's like, she's like, wow, that's pretty hot. And so it's just a testament to the way you carry yourself, you know what I mean? And the energy you have sometimes. Sure, that's a confidence play, but at the same time, the way he was, that's something that people notice. That's my point, right? For my wife being like, "Oh my goodness, that's so kind of attractive," or whatever he did, right? That's part of the whole thing I'm talking about, right?
There's the action, but also the presentation of it.
Yeah, and everything plays a role, right? And it's like if you're going for an interview or you play in a sports team and you come to the diamond and you're like, and I need to pick a starting pitcher. And it's that guy or it's the other guy like, yo, what's up, man? You ready, guys? We're going to do this, man. And the other guy comes in, and they're both really good pitchers. I'm probably going to go with the guy that's oozing the confidence and versus the guy that's just like, hey, coach, and just like, because, that's part of life, right? So.
Yeah, like when I first started, everything was like just super bitter. And I was like, I couldn't taste the difference in any of the coffee. Like, because what they would do is they would give me like a bunch of espresso shots and they'd be like, okay, take a sip and then like describe it. And I'm like, they all taste like burnt water. And I was like,
oh, so you went to one of those focus groups?
It was Nespresso. I worked at Nespresso.
Oh, when you worked there, okay.
Yeah. And so that's how they would train you on like flavor profiles. But then as I kept working there and I got like kind of surrounded by it, I started picking up on it, and then I would like you develop the palate for it. And then eventually I was like, you know what? Coffee isn't that bad. I definitely don't drink it for the caffeine. I've now gotten myself accustomed to like the flavor of it. And so I like whether it's decaf or caffeinated, it's just nice. And then like I slowly went from like, oh, like McDonald's coffee is so good to like, damn, this is not good at all.
No way?
No.
Yeah, I know. That's like my buddy who's like big with his coffee machines and all that.
I remember like when I redid, like when I renovated my kitchen, I gave some schematics to the builder being like, hey, can you turn this corner of the kitchen into like my corner? And like, this is the look I want to go for. And they're like, yeah, sure. And so they built me like a little coffee corner. I got my machines there.
In your parents' kitchen?
Yes.
Oh, so you just basically
because
told your mom and dad, like, look,
be...
this is Chintan's corner.
Yeah. I literally have a giant sticker or like a giant kind of like poster thing that just says like coffee time. Let me see if I'll see if I can find a picture of it. But I basically put all my machines there and I was like...
I can see your mom finding that cute and your dad probably just, whatever, man.
Yeah, they don't know how to operate my machines, which is funny because it's just one button.
Yeah.
But I kind of like added up like the cost of like everything that was on like the shelves and like the machines, and I'm like, damn, I have like $2,000 worth of like stuff.
Oh, I'm not surprised, man. Like some of my buddies with these espresso machines and all this stuff.
But here's the thing, I don't have one of those like expensive espresso machines.
No,
like they're just like Nespresso items. But like I got like a bunch of stuff like when they first came out with like the first edition of a lot of stuff. Mm-hmm. And I'm like, damn, it's expensive. Which is funny because I barely paid for any of it. So it's like the value of everything is like maybe like $1 or $2 grand. But in terms of like how much I actually paid for it, it was probably like $100. And I thought that was kind of funny. But it was interesting.
This machine just does one thing at a time, takes a while. Like life is funny, man. Like, you work in order to provide, right? And then I always have this saying, it's like, I don't think you have to love this is my own saying. I don't think you have to love your job, but you should like it. Because, there's always people, I love my job. I would never believe that. Like, like, unless you're like an athlete or something like that, or like a musician. And I don't even know how much some of those guys love their job. You know what I mean? So
yeah, I find that most people, you should have something that kind of reminds you of like why you chose this thing. Because like the one advice I got the most in undergrad when I was pre-med, which is if you're going to do this for the money, don't do it. Like in terms of like being a doctor and whatnot.
Yeah.
Like they're like
you were okay. So explain to me more clear. You were in undergrad and you wanted to get into med school. You wrote your MCATs.
Yeah.
Did you apply to med school?
No, not at that moment. The moment I graduated from like MCAT, like that week, or not MCAT, from undergrad, that week, and like getting my diploma, I was like, fuck, I don't want to do this anymore. Because like I realized I'm like, what? Because I asked myself, like I sat down and I was like, why do I want to like do ER surgery? Because that was like the goal. And I was like, is it for money? And I was like, partly, but I'm trying to think like what other reason. And I was like, I couldn't think of any other reason. Because a lot of people like go off into like those kind of like professional field doing like, I want to help people. And I just sat there and I'm like, I could not give a shit.
So there's like a ton of people like that in
Yeah.
in medicine and in dentistry and in a lot of other professions, chiro, whatever. And I don't think they care. Like there was this dentist who, we're not online, right? No, we're not recording.
Oh, well, it is. Because I was recording myself. You can say it and I can like cut it out. Or if you want, I can turn it off.
Anyway, no, you don't have to
Okay.
turn it off. There's this one guy I went to school with, and he was all about, because he does have like a practice, whatever, right?
Yeah.
So he's all about like money. And he used to say, oh yeah, I'm going to do this. I want to get into like dentistry or whatever, right? And like lo and behold, he had those goals and he did, and he's a smart guy. But I remember like how he used to say certain things about certain people and groups and things, and then like all of a sudden like he has like his practice, and then I hear him on the radio, and they're talking about him in this certain light about how he does. I mean, I don't want to get into it because it's recording. How he does A, B, and C in his practices, and he plays this type of music, and he's just. And I'm like, this is so fucking phony. Like this dude was like saying shit about this stuff, talking about these groups like this and that, and now wants to be Mr. Cool and like.
It's like kind of
and
two-faced.
he just yeah, and he's just, this dude's always been like that, like fake. And you just know he's fake. And you may come up to me, hey, how's it going? That's cool. Like, hey, what's up? If I see him somewhere, no problem like that. But like to me, like that's just like cringe, right? So there's a point where making money is cool. Like you need to survive, right? It's good. It shouldn't be your primary focus. But I do think like doing something where you have a bit of a purpose and you enjoy it is good too. And it's hard, man. Like I don't know, like some people will do jobs. Like I remember doing this night depository at Scotiabank, and we're just stacking money, $5,000 at a time. Put a band around. You probably like, you feel like $1 million goes through your hands by the end of the night. You smell like money. It just becomes dirty paper. It's not even money. The first day you're like, this is so cool. I'm handling so much money. Well, then it's like, it's not yours.
Yeah.
So who gives a shit? And then it just, and then I meet these guys there, and I know I'm in university. I'm going to be trying to do something else, and they're smart guys. Like one guy was this Chinese guy, and not the stereotype, but like into the sci-fi and all this stuff. And we were talking about all these things, and he knows a lot about a lot. He's an intelligent dude. And I was like, I don't remember his name, but I'm like, why are you doing this? Like job, like I mean, it's a good job. A job is a job, and I don't knock anyone's job. Like respect, man. You work, you earn money. I got respect for you, man. But, I think that his potential could be with a job which is a little bit more, maybe academic based. But, he started there and then he's stuck there and then he didn't get back and go to school and he has bills to pay, and now what are you going to do? Who has the money? Not everyone, like sometimes parents are cool. They're like, oh, stay with us and you can study and I'll help you with your education. But not everyone has that opportunity. And then there was another guy. He was a really smart guy, but that's when I was young, and I'm going back like, man, I want to say 30 years ago, and I was working at this place, and then there's another guy there, like Indian guy with the family and stuff like that, and I'm like, why are you doing, like you're pretty good with all these things? And he's like, I have to pay the bills, Dave. What do you want me to do? I have a kid. He goes, if I leave, what am I going to do? No one's going to, if I study something or try a new job, he goes, I get paid okay here. So that he's probably going to do that job unless he moves up for another 25, 30 years, right?
Yeah.
So it's not, so like all of these opportunities and doing what you love and all that, there's a lot of like gray area when we're a little entitled. Right? Like even me being a generation older than you.
Yeah.
Right? We're like a little entitled because our parents came here and they build it up so you have a place to stay. They help you with your education. You actually have a choice. A lot of people don't always have too much of a choice. You can say everyone has a choice, but not everyone has too much of a choice.
Yeah.
So it's tough. It's So sometimes, like, if you can do something you like and it's good. Like I think what you did was cool. Like, I know it's not the easiest route and everything, but like you're passionate about it and you do your research and all that. And fuck, why you want to be in the fucking emergency room?
Honestly, when I first thought about it, I and this is super naive of me, but like when I was younger, I always thought it was gonna be like those TV shows
Yeah.
where it's just like high stakes, like a high risk, high reward kind of situation. And
Only Dr. Chintan can solve this problem.
something akin to that. No, not exactly in that sense, but I did like the kind of ambitious, like on your feet, having to think about like and apply what you learned in a practical situation. And then later I found out that even doctors use Google when they don't know something, and I'm like, okay, that kind of broke the image for me a little bit.
Totally, man.
It was more of like a crack, not a full break. But then I the reason I chose medicine was for two reasons. One, so that I could continue studying, and two, because it was a field in which anything that I learned could be applied in practice as well. Because there are so many careers where it's like you go and you study, and then like you never use the information you learned. And med school was slightly different from that, in which like you learn a bunch of things kind of in like this kind of broad scope. And the only or one of the only careers in medicine in which where you learned about every kind of system can be applied
Emerge.
is emergency, right? Because if you became like a cardiologist,
Yeah.
you wouldn't have to worry about like the brain. You wouldn't have to worry about.
And then when there's a certain aspect of the emerge which goes beyond that guy's scope, then they call the specialist. Like,
Yeah.
okay, we've identified it's a heart problem, but now we got to fix it, so we're calling this cardiac surgeon or whatever, right? But yeah, you get to touch on everything, right?
Yeah. And you kind of like, you get to be this kind of jack of all trades as an ER surgeon. And that's what I ended up kind of embodying both like in business as well as in content. Hell, like my freaking YouTube banner at the time right now, it literally just says jack of all trades at the top, because that's what I always assume, because everyone knows that quote, but only the first half of it, which is a jack of all trades
Master of none.
is a master of none. But the second half is like, but is often better than a master of one.
Oh, okay, that's interesting.
Yeah. Which is like
Who said that quote?
I honestly, I
Or
don't
did
think.
somebody else just make up the next two lines?
No, I think that's the full quote, but the most memorable is like that first line. I don't remember who originally said it, but it always made sense to me, because it's like, do you want the dude who's like a master, like guitarist, to be like helping you commit first aid? No. But you want the dude who's like, okay, I'm a little bit good at guitar. I know a little bit about first aid. I know a little bit about how to change a tire. Like you kind of want to be.
Well, those people are genuinely the most interesting group of people, because conversationally they can connect with anybody.
Yeah.
You know, a lot of the time. Like my wife has this friend Jorn, and he grew up, and like his dad's German hands-on, so he grew up learning stuff and everything, like fixing things. And then he went and lived on the East Coast, and he had to deal with cars, and he wanted a car. He had to learn how to build one, like fix. And then he knows like just everything, like so much about so many things. And there's a handful of guys that are like that, and I think it's pretty cool. Like I find it kind of interesting, right?
Yeah. I always
I'm not
looked
one of
at,
those, but like, you know, I'm not like a handy or anything like that.
Yeah, I try to be good or just good enough at a bunch of things just to kind of get by in like situations. Like if you freaking collapse, like I know how to do CPR, like I know how to swim, like I got a lifeguard certificate way back when, probably not anymore, probably not valid, but like I know a bunch of like things just to kind of, like I know a bunch of random things, right? Things that might not seem useful now, but like in that specific situation helps. And then
I just had this like moment where you're like, about the lifeguard, and you're like, maybe not now. You're like, save him, Chintan. You're like, it's too cold. It's too cold.
I'm not like that.
It's too cold. You know, it's like It's like, it's been a while. It's too cold.
I don't even have an accent. Why are you doing the accent?
It's always more fun. That's my generation, man. It's always more fun.
But then the way I kind of look at the jack of all trades is like, it's like the step one. The Renaissance man is like the kind of evolution of a jack of all trades, because it's like
Fair enough.
jack of all trades is like you're decent.
But the
at a lot of
Renaissance
things.
man is such a bullshit saying. Because there's like one dude who was the Renaissance man.
Yeah, it's one guy.
Like in Europe.
But, like,
Maybe
that-
there were some guys in India. There's guys everywhere, right?
Yeah.
There's Renaissance men all over. But like the European guy was Leonardo, right?
Yeah.
Da Vinci. So, you know,
But that's kind of like the goal.
The
'Cause,
goal,
like,
yeah, the
Because like
goal.
you could be a jack of all trades and then just keep increasing your list, or you
Mm-hmm.
could have like a set of skills and then you work on just building all like
Yeah.
the verticals up to like the mastery, and then that's like the end goal.
oh, yeah. Like, and then, you know, sometimes you don't want to be a master of one thing or a jack of all trades. You just want to enjoy your life.
Yeah.
Nothing wrong with that either. Some people are like that.
Yeah.
Right? You're good at something and then you do it. You don't have to be great at it, but you do it, and then you like to do things and you just chill. You know, probably like my dad. You know, doesn't really like, but everyone likes him, so it's weird, right? Maybe that's his skill, right? Like he's just easygoing and friendly, so like everyone likes my dad. But you know, like he's not fixing anything anytime soon. Maybe some small little things he'll try, and he's not like working anymore. He's just, but you know, goes to the gym all the time, like every day, and just watches some stuff and stays active. Drives my mom around everywhere. Seems to like his life, so it's like it's not bad either. But you know, I know that from a goal perspective, all that other stuff you said is important. Like what, you know, what are your goals? What do you want to do? Where do you want to be, right?
And those are important questions, but like one thing that I always thought for like a very long time that you had to have like all of that figured out like early on. And what I mean like early on is I'm like talking like early 20s, like late teens. And I was like, but now like I turned 24 like just a few weeks ago. And God.
Fuck, man, you're like half my age, man. You're like more than less than half my age.
It's funny because I was like stressing. I'm like, damn, I'm in my mid-20s now. Mid-20s.
Mid-20s is no, it's still like I liked 30s, but I studied a lot. So for me, like me enjoying 30 to 36 is like, or 30 to 30, yeah, is like you enjoying 25 to 31 because, or whatever, or 24, you know, because I kept studying and didn't really get into the real world until I was 27. And it took me a few years to get going, whereas you've been now doing this for a couple of years. So now you're kind of getting your foot into the real world and at a younger age. Like a lot of my friends that went to university from like 18 or 19, 20, 22, and then 23, they start working in the bank, let's say.
Yeah.
And now by the time they're 26, 27, they feel like, okay, I'm in a groove, I'm making money, I'm being more respected now, you know, I'm getting respect. Like, yeah, I see.
For me, like going back to kind of having everything figured out, and then like I turned, it was I had like it was like a two-step epiphany. The first step was on the graduation stage when I got my degree, and then
University degree.
yeah, my university degree, and then the second part was on like my 24th birthday, so just a few weeks ago. So it was a bit of a delay, but like I realized that the path that's laid out for you that isn't chosen 100% by you is not the path you want to be going down. Because like I've been fortunate enough to like see my parents and like see my friends and see them have like certain regrets for actions they've done. And I am thankful so far that like I have not regretted a single thing I've ever done in my life. Like I have zero regrets.
Really? That's awesome.
Which is something that my friends have a hard time like kind of believing.
Yeah.
And I'm like, and so but that's because like if I make a choice or or do anything, I made that choice with the knowledge best available to me at that time. And so like you can regret a lot of things like in hindsight once you gain more information, but I'm like, if I made a decision just based off of what I knew at the time, then like there was nothing else that could have changed.
Yeah, no, for sure. Yeah, you're right about that. I mean, in that sense, it's a good philosophy on life, like not to regret, because you do live in the moment and you make decisions based on what's around you and what's, I mean, sure, you can still fuck up, but
Yeah.
yeah, it's when you like, I think when you know you can make a decision that by possibly choosing A instead of B can hurt others consciously or hurt a situation consciously, and you choose to do it and out of selfish means or needs, then later on in reflecting, I can see regret with people, because in the moment you knew that it could have potential negative effects, but you still did it to benefit yourself. So probably, maybe a lot of the decisions you make because you're not in that situation where you're considering harming others or being selfish, you don't have regrets. Whereas maybe some people, they'll make decisions from a selfish perspective.
What are your thoughts on train track situations then? Do you know what I'm talking about? So there's a common kind of like dilemma that's posted online, which is like there's a train arriving on a track. You are in charge of the lever that changes whether the track goes left or right. On the left track, there's a family of 4 tied down to the track. On the right side, there's like a single like innocent woman or whatnot. But you have to make a decision. Who are you going to
Kill?
yeah. Like someone dies, like someone gets hurt.
Yeah. I would think naturally you're defaulting to killing one person over 4. But then, if it's one baby and 4 adults,
Yeah.
maybe your mind
Then
frame
there's
changes.
another dilemma.
Yeah.
Yeah. I think the original question poses like it's one child or a family of 4. Like an innocent child. Yeah, it's something akin to that.
Yeah. So there's an interesting one that I pose to people, because I used to have, before we had kids, we had pets, and we almost wanted kids, but we didn't have kids at the time. And we took our time. But people would make comments about, oh, well, your pets aren't like your family. I'm like, they are, though. And I said to them, well, if there's a burning house and you can save your pet, who's like, let's say your pet's not 15 or something, your pet's like 2. And they make eye contact with you, like, meow, meow, or woof, woof. And then the other building, there's like some person, a human being in there. Some people that consider that pet part of their family and have a connection with it are going to look to save the pet. And I'm going to go get him. I'll get you too, but hold on. Like, let me get this guy first, because is that right? Is that wrong? I don't know. But then I found once I had kids, I was like, if there's ever a kid that needs to be saved, like, kid is different. Even before I had kids, like, a child's different. But like an adult, or like my pet that I've known, like that's 2 years old and like they're living with us and like 2, 3, like I'm not saying I don't want to help you, but I'm not gonna let you die because I know you.
Yeah.
Like you're part of my fam, like. So that's another weird one and then people don't understand that at all. They're like, oh, that's like a animal, that's not a human. Yeah, but human beings are the worst animals in the world. They like kill each other for stupidest reasons. They kill each other over something they can't prove exists. Right?
Yeah.
Or that they can't prove that they can't accept that maybe there's more than one model to. You ever hear of this like alien theory where like fuck, it's just gonna ruin my credibility if we ever get.
It's okay.
If we ever get in a,
It's fine. Like there's no reason for.
if you ever get in a fight, you're gonna be like, oh, look what he said about. So it's like,
Don't worry, this is not going on my cancel.
no. So somebody brought something up to me. Okay, you've watched the Wonder Woman movie with Gal Gadot
Yes.
with Ares as the primary antagonist.
Yeah. Yeah.
So it's this concept that like all of these gods and all these things were once kind of like aliens or whatever, and they came down to Earth and they were all in different aspects here and helping cultures in different way and showing them things and introducing them to things, because in the past there was a lot of literature of like Vipanas, like that's what's like the in the Mahabharata they talk about spaceships and all that. In different cultures there's different things like that, in Egyptian, in Aztec. So it's just like how they were all here at the same time doing things and were manifested in different ways or called different things, and then eventually they all left. And I find that interesting, right? Because everyone's always like, well, no, my God was right, or this person said this or that. But maybe like there's something there where all of those vibes are all around at the same time. So maybe we're not that different, right, in our thoughts, but everyone tries to make it that way. So just leave each other alone, right? But
Yeah.
anyway, just so that just, anyway, back to like human beings being bad people, right? That's my point.
But it's also interesting because there is a bit of a dichotomy there, because human beings are both have the capacity for innate good and like innate evil. Because like if you're on the outside choosing between the human and cat, you have the capacity to have good, to extend grace to someone that's not a human. But then there's also like the evil that's like, hey, I'm willing to let you die for this cat.
True, but like, would it be like let you die, or like let me save this person, this thing first because I'm more connected to it, but I'm also going to try to save you too.
But if you had to choose between like one of them is gonna die, like you can
Okay, if
only
one of
save
them,
one.
yeah, if you can only save one. But
some
see,
people will.
that's the beauty of the other side of it. You said like you wouldn't think that. You'd be like, I think I can save both of them, but I'm gonna save this one first because I care more for it. But I will try to save you. I think I can save you. It's not like I'm not going to. But could that decision that you're saying be there, like the train track thing, whatever? Sure. Like, that could be there now. It could also be like you go to save this cat and the cat ends up dying anyway, and you die, and then somebody saves this person. Like, and then if you went to save this guy, then they would have saved you too. Like,
Yeah.
So you don't know. There's permutations, but I
And then
don't know.
there's like the whole. I don't know if you've seen any of like the one gorilla versus 100 men thing.
Yeah.
online.
This has been going around a lot. Yeah.
Yeah.
I've seen it. I've seen this thing where it's like, can 100 men beat up one gorilla? Right.
Yeah, and I think there was a study. It is possible, but I think I think someone actually did like the math on it, or like found like the analytics from like past like fights, which is funny that there's like a track record of this. It basically said that like if they were to do it, I think they said that like 60 men would die.
Well, that's the point, like, of why it's a stupid thing. Because if you just take sheer strength and agility and whatever of 100 men, if they all just swarm this thing, there's no way he's going to be able to 150, 180 pounds, average dude, maybe 170, 180 pounds, times 100, right? 1.8 tons or whatever the hell that is. And they're all forcefully going on top of this gorilla. You're going to eventually win. Yeah. And people will get killed and you'll smack. But then who wants to die?
Yeah.
That's the point, right? Who's stupid enough to sacrifice himself? So it's almost like an exercise in like, if I had like, okay, I don't want to use the word. If I had 100, if I'm the evilest person in the world and I have 100 indentured or slaves or indentured workers or whatever that I have all the control over, right? So basically, if I'm colonial Europe, 300 years ago, 200 years ago, 100 years ago, and I have all these people, right? Like, and I force them to do this, what would the outcome be, right? That's basically what you're saying. Because it's like no one in their sane mind is engaging in this activity, you know.
Yeah, I think like the argument was that on a strength to strength basis, like the gorilla will win every time, but it's like the cunningness of man and like the ability
You think that's what it is, or do you think it's more bare bones stupid? Like, can 100 dudes beat up a gorilla? Like, that's what I think it is. I don't think people are thinking like this, Chintan.
I think some
Have
people
you seen
do.
the people that are putting it like? And I'm saying like I'm probably one of them that were just like more like can 100 guys beat up the gorilla? Like that interests me. Like, but this whole side of like the
like it's like
cunning
the
and
teamwork. Yeah, like because like we don't know if like it's not like on a strength to strength basis because it's not 1v1s, right? Like no one said what the rules were. It's like like a free for all, or it's like a team deathmatch, I guess in the sense. But it's like if like the 100 guys worked together and formulated a plan, yes, they would win.
they have no weapons, right? That's the
Yeah,
point.
no, it's like barefisted.
Then what plan are you putting together? Okay, like I'll distract him in the front, you punch him in the back, and we'll just take turns until we keep punching him in that same spot, you know, like. And then
I mean,
one
yeah,
day
I
he's gonna
guess
turn
like
his hand
it
around
could
and hit-
work. It could work.
Gorillas are scary, man. They're big, like silverback. We're talking.
It's funny because I saw one meme online, which is like when the gorilla versus 100 men like fight starts, and like the gorilla makes a prayer to like Harambe. Do you know who Harambe
Harambe,
is?
yeah, I know.
And I was like, damn, and like it's just like the face of like 100 men, just like sad. Because they're like, no.
Prayer to Harambe. Yeah, I remember Harambe. That was around COVID time,
Or it's like
2019, 2020.
yeah. Or it's like when man number 43 like hits like a clean uppercut and gives like the rest of the guys hope. Like really dumb memes. But they're so funny. I have no idea where it started from. But it is funny. I've considered like getting a few friends together and like buying a gorilla costume. Like I've actually thought about like making this as like a post online and being like getting the gorilla versus 100 team like IRL and then just like inviting like a bunch of random people like guys to get together in like a giant park and then having one dude like dress up in like a gorilla costume.
I don't want to be that dude. Because out of 100 random guys, there's gonna be 3 psychopaths that just
Like,
want to kill him.
There's like this one SpongeBob episode where it's like Patrick's like wearing like a gorilla costume, and I was like, I gotta find that exact costume.
Oh man, that's funny, man. No, I don't. A lot of weird things out there, man. I don't know.
Meme culture is interesting.
Meme culture, yeah.
Yeah.
Memes are fantastic.
Yeah.
Like I always like joke around with like the kids on the baseball team, and I was like, if I had all these TikToks and all these things when I was young, like when I was like 15, 16, I go, I'd be a millionaire right now. I go, we do all these things, and I'm like, oh, I don't have energy for it now. These like these little videos and impersonations and stupid things. I'd probably be one of those kind of guys.
Like the skits?
Yeah, all that shit. Yeah, I'd probably do like a lot of that stuff, like the skits and the impersonations and all like goofy things and like, but I think about them all the time, man. I have a whole like long note on like stand up, like different kind of things I think, and I've never done it and I never plan to do it.
Yeah.
But it just for some reason I like to just write it down.
I really enjoy comedy. In terms of like how I am with like friends, it's more of like witty remarks. Like I'm really fast with that.
Yeah.
There's one friend I had. We've known each other since kindergarten and we're still friends. And he has been like kind of like the receiving end of like all of my like witty jokes and like remarks for like 17 years. And it's funny because I think like I don't think I've ever made fun of someone.
He's still alive, right?
Yeah. He's the same age as me. But it's funny because like it's just
That's like a torment joke. Sorry.
yeah. But it's like
Very
imagine
cold.
constantly being made fun of by someone or like being like the butt of a joke for like 17 straight years.
So I bug my cousin a lot. He's a little bit heavier set, and I'll make jokes all the time. But because I'm older than, Indian culture.
Yeah.
If you're older than someone, like I could be the dumbest person in the world, he could be the smartest person in the world. If I'm 3 years older than him, I can say whatever I want to him. Like it's so stupid like that, right? It's like you can make fun of your because it's like that. He's your older like cousin, brother, or whatever. You can't say anything back. So he has that thing like. He's like sweet. Like I'll talk to him on the phone. I'll make some jokes, and when I say bye to him, I don't know if it's conscious or not, but like he always waits till I hang up first, and I think it's a respect thing. I've never asked him, but I think it's like some respect thing because I'm like just older than him by like 5 years or whatever. But yeah, like there's like the guys that I thought you were gonna say that you had this best friend of yours where you go back and forth with witty remarks. Like that's like me and my buddy Colin since we've known each other. Like we're kind of like quick with that stuff. But yeah, there's always the one guy in the crew that's the butt of the jokes of it, right?
Yeah.
And it's like sometimes it's like right to their face, which is funny. And then sometimes there's some guys like that, but then sometimes there's guys that are really sensitive. So it's the behind the back guy where like when they're not around, you like make some jokes and you laugh, right? So hopefully that's not me,
It's funny talking about like all like kind of like Indian culture, like in that sense. I remember when I was like a lot younger. I think I was like 12 or 13. And I went to California for a cousin's wedding. And I remember like all of like the older like kids, they didn't want to interact with me. And I couldn't figure out why. And it wasn't until like I came to like one of the receptions and like literally shorts and they saw like my leg hair and I heard them talking about it and be like, yo, he's actually kind of grown. Like in the sense of like the leg hair. And I remember not really caring about it, but then they started interacting with me and like we got along and stuff like that. But I thought about it like a few months ago and I'm like, is leg hair really like a rite of passage?
That's weird.
I
don't
know.
know, man. I don't know if that's really.
Like to talk to the older kids.
Is that really what it would be?
I always just kind of, it always stuck with me.
I don't know, man. That's kind of weird. Unless maybe they were like, okay, maybe he's more like a mature guy. I don't know. But I do know, like, I asked my cousin, the same one, like I joke around with, and I asked him about, like, why do dudes in India all have these mustaches? Like, they won't always have, but they always, like, rock the mustache. I go, it's just so whack, man. And he's like, no, I think it's kind of like, when you've come to be able to grow that, then you want to show like you're more like you're getting to be a man. So it's kind of their way of expressing that. I'm like, oh, interesting. Okay, I never really thought that. I just thought, what do I want to rock that's going to make me look the best? Whether it's like the goatee or the mustache or the clean shave, like how am I going to look fresh, right? But like I didn't think it was like, I never really thought of that, but that's interesting. So kind of towards the angle.
Yeah.
Of what you said. I thought the story would be more interesting, like they didn't talk to you and it was because of something else. More than like, I thought this had more volume to it. No pun intended.
No, it was
like,
it was purely like
it's
superficial reasons.
Yeah. It just.
But the funniest part to me was like that I heard them gossiping about like how I had leg hair, and like they were saying in like in an admirable tone. And it never made sense. Like I'm like 11 or 12 at this time. Like it doesn't make any sense to me. And then like suddenly you're all friend like fucking like the last 5 days you were like so cold and rude.
But were they rude to you though? Maybe because you're just Canadian and we got a different vibe. So I'll tell you something about American Indian people. Like not American Indians, but like Americans of East Indian descent.
Yeah.
You know what I mean. Like they're fucking weird. Like they really want to be white so bad. From when I was a kid.
Yeah.
And we grew up in a very urban style, like in Mississauga. So we had like Indian friends, West Indian friends, black dudes, Chinese guys, whatever. We had like all these different groups. And then you also had some Portuguese and Italian and regular whites, Canadian. So you guys like a melting pot and everyone knew each other. They learned from each other's cultures and stuff. So, and like hip hop music was cool. It started when we were growing up from 86, 87, 88 when we were like younger, 10, 11, 12, 13. And it's like, it was like not cool to be like white. Like it wasn't cool to be like, oh, I'm listening to like New Wave, or there's these groups like Depeche Mode and New Order and all these like stuff my sister would listen to. Like that wasn't cool. Like the dudes, we were like, we're listening to hip hop, man, and like blah blah blah. So when I would go to the States and meet these guys, like, hey buddy, how's it going? And it's like, what the fuck is this guy, man? Like, and then their hair and then the whole look, and I was like, I couldn't like. So I never liked that vibe, right?
Yeah.
Like to me, like it was always like they would always try to like over anglicize their names or like, change things up too much. And I was like, I'm just not down with these guys, man.
Yeah.
So it's like I always had that feeling towards like, if we go to like a function, right? You mean you're talking like these Indian functions, family function or something. Yeah. I was just like, so it was always weird for me, man. Like, so I never really, but that was like my take on it. I don't know. Maybe they probably thought I was a fucking idiot anyway. So that's part of it too.
Like, why is he not white?
Yeah. Why does he always have something annoyingly sarcastic to say? Like that's kind of me. So
Yeah.
anyway, it is what it is.